this video, we will be talking about the figure of 8 suture, which is a good technique to learn, especially when you're dealing with patients who might be taking antiplatelets or anticoagulants, in order to be able to apply some pressure effect on top of the hemostatic agent that you have used inside the socket. And the way I remember it is it's like putting two simple interrupted sutures in the two adjacent papilla, but only tying them once. As you see in the schematic, it's important that the sutures are in the interdental papilla as far apart as possible and not close to each other in order to achieve that cross effect and give you that pressure aspect on top of the hemostatic agent. This video shows the figure of 8 suture, which is sometimes used across an extraction socket to aid in maintaining the blood clot in place, or to keep, for example, Surgicel in the socket or a collagen block if you are doing socket preservation. And the technique usually starts similar to the simple interrupted suture by going through the buccal tissue towards the palatal or lingual tissue at 90 degrees to the tissue. You go through the socket through the area of the interdental papilla, and you go out through the interdental papilla on the palatal side. You then will have to go back to the buccal side again, as you see over here, and you go through the distal interdental papilla from one side and exit through the interdental papilla on the palatal side distally as well. That causes a cross effect on the surface, as you can see developing over here. And it's quite useful if you put the stitch through the collagen block or the Surgicel to make sure that that material does not disappear at all. What you do then is you need to tie that knot to complete that figure of 8. So you use the surgeon's knot with 2 clockwise rotations, grabbing the loose end of the suture, as you see over here, and that will start that cross on the opposite side to complete the figure of 8 that we are trying to achieve. Make sure that the knot is flat on the surface as well, to avoid elements of food debris or black debris on that side as well. Then you do 1 counterclockwise rotation, as you see over here, to tie that knot. You need to move that knot away from the line of the incision. I usually tend to put another clockwise rotation to make sure it's completely secure, and then you cut the edges about 2 to 3 millimeters away from the knot to make sure that the knot does not get undone and also does not irritate the patient, and make sure it's placed on the buccal side. And there you can see that figure of 8 rotation with the knot away from the incision line.
On the 3rd day of suturing, my surgeon said to me, grasp your needle holder properly.